Today, we will be talking about safe sleep practices. Safe sleep practices are much more detailed than you might think. This journey will give you helpful tips and guidelines to follow so you can ensure infants and toddlers are sleeping safely while in your care. Knowing safe sleep skills is incredibly important. It's the key to preventing accidental suffocation, strangulation, and reducing the risk of sudden infant death syndrome, also known as SIDS. Let's talk about sleeping positions. For infants, especially, it's important to place them face up on their back while sleeping. This will keep the child's airway open and their gag reflex will prevent them from choking in their sleep. Babies who sleep on their backs are much less likely to die suddenly and unexpectedly than babies who sleep on their stomachs or sides. Sleeping on their sides can be more dangerous because they can roll on their stomachs more easily. However, if an infant can roll between their backs and stomachs independently, it is okay if they sleep on their stomachs, but you should still place them on their back for sleeping. You should also consider speaking to somebody at the center prior to making sure a student can sleep on their stomachs. Let's move to the sleeping area. When sleeping, infants should be placed on a firm surface that does not give in when they lay down. The surface should be tightly fitted against the crib or bassinet walls, and there should not be a gap in between the walls and the bed. The sleeping area should have walls to prevent falling and rolling, and the infant should not sleep in products that are not marketed for infant sleep. These are things like strollers, swings, car seats, high chairs, etc. So let's talk about materials. Make sure the sleeping area is clear of all blankets and loose fabric, stuffed animals, toys, window cords, and electrical wires. These objects can greatly increase the baby's risk of entrapment, suffocation, and strangulation. This includes pillows and pillow-like toys, quilts, comforters, mattress toppers, non-fitted sheets, blankets, toys, bumper pads, or related products that attach to crib slats or sides. This also includes window cords that might be hanging near the crib that are accessible to the child. So, what's your role in all of this? You don't get much of a say in the setup of the napping area, but you do have a responsibility while you're working at a center. You should familiarize yourself with the center's sleeping schedule and sleeping equipment. They will have a designated time for students to take a nap or rest or do their homework. It depends on the center. And you should also find out where the sleeping equipment is. Ask how you can support the children during nap time. Some centers may ask that you just sit and wait for students to wake up. Other centers may allow you to read a book or put on some soothing music. And sit tight. Nap time is for relaxing for you and the kids. This is a great time to decompress for the day or support students that are having a hard time falling asleep. Look at you. You just earned your nap time hero badge. Nice work.